Hello everyone, how are you today? Before we begin our presentation, let us introduce ourselves. My name is Nailatul Hana Zulfa and my friend name is Ummi Lathiifah. We are from Bachelor Applied Midwifery Semester 5. Okay, we would like to give a presentation about case report with topic Mrs. S, who is 27 years old, G2, P1, AB0, AH1, 22 weeks, pregnant was obtained with CED and milk anemia. The title of the case report is Mrs. S, who is 27 years old, G2, P1, AB0, AH1, 22 weeks pregnant was obtained with CED and milk anemia. First of all, we are going to start from showing the background of the case report. Reduced red blood cells or erythrocytes in circulation are a mass of hemoglobin that is unable to perform its role as an oxygen transporter for the entire network are both symptoms of anemia. While anemia in pregnancy is defined as pregnant women who have low hemoglobin levels less than 11% in the first and third trimesters, and less than 10.5% in the second trimester as pregnant women who experience iron shortage in the blood by Mo 2002. Iron deficiency anemia is the most common cause of anemia in pregnancy and is brought on by a lack of iron in the diet, a disturbance in reabsorption, utilization issues, or an excessive loss of iron from the body, for example, hemorrhage. By Yogyakarta 2006. Iron deficiency types milk anemia with hemoglobin levels between 10.9 until 10%, moderate anemia, and anemia during pregnancy are the different types. Severe anemia if the hemoglobin level is below 7% and between 9.9 and 7.9%. Anemia-stricken pregnant women must take tablets containing blood in the dosage prescribed by the midwife. Because current research suggests that pregnant women's hemoglobin levels can be increased by taking regular blood aid tablets. And the next background is about chronic energy deficiency or CED. Chronic energy deficiency or CED is a disorder that affects pregnant women and is marked by a persistent or chronic lack of food and the appearance of a variety of health issues by Sayoko 2007. Mid-upper arm circumference or MUAC measurements are one kind of anthropometric test utilized to calculate the risk of CED in females who are reproductive, including teenagers, pregnant women, nursing moms, and couples. While the MUAC cutoff for pregnant women at risk for CED is 23.5 cm. If it is less than 23.5 cm, the woman will develop CED by Supriyasa 2012. Age, height, and weight are typical pregnancy-related risk variables that can contribute to CED in expectant mothers. Anemia and CED, which affect pregnant women and are a leading cause of maternal death in Indonesia, are more likely to occur in young, newlywed women.
Unexpected mother on May 30, 2022, Mrs. S, who is 27 years old and G2P1AB0AH1, 22 weeks pregnant and has a history of anemia on previous testing with HB values less than 11%, visited the medical facility and complained of feeling tired when completing bodies. The mother claimed, based on subjective information, that she was still working commercially at the time. Due to DKP, previous birth in 2019 were performed section cesarean. The patient was free of systemic illnesses and no allergies to food and drugs. The finding of the physical examination revealed good general health and consciousness compartments, blood pressure 86 per 52 mmHg, pulse 92 x per minute, resuscitation 20 x per minute, temperature 36 Celsius, age 145 cm, weight 34.7 kg, BMI 16.5, upper arm circumference 19 cm, head-to-toe examination revealed no abnormalities. The fetal head is under the mother's abdomen but has not yet entered the PAP. The uterine fundal height is palpable at the level of the navel. EFW 620 gr, FHR 137 times per minute. Laboratory test result on May 30, 2022. 10% for HB levels over blood group, HBsAg, HIV, urine protein and syphilis non-reactive. Because the typical limit of mid-upper arm circumference MUAC for pregnant woman is 23.5 cm, the mother's mid-upper arm circumference MUAC of 19 cm falls inside the low mid-upper arm circumference MUAC group for pregnant woman based on the examination result. Mrs. S can be classified as a pregnant woman with CED, chronic energy deficiency, based on this statistic. According to the result of laboratory tests, Mrs. S is classified as a pregnant mother with mild anemia because her HB level of 10% also contains a low HB level with a normal limit of 11%. So that the obstetric analysis of Mrs. S, age 27 years, J2P1 HB0 AH1, 22 weeks pregnant, has obtained with CED and mild anemia. According to an obstetric analysis, Mrs. S, who is 27 years old, G2B1 AB0AH1, 22 weeks pregnant, was obtained with CED and mild anemia. Mothers can fight this by eating a balanced diet that is high in green vegetables, high protein side dishes, they're healthy and hygienic foods. Because the stomach typically feels full during pregnancy, it can be controlled by eating frequently in little portions. By sleeping for 1 to 2 hours and getting 7 to 8 hours of sleep at night, you can establish a habit of adequate rest.
The mother is advised to regularly take blood aid tablets twice a day before bedtime with sweet orange juice for optimum absorption in order to treat mild anemia. In order to monitor HB levels, urine protein, and other laboratory testing, she is urged to return the following month. Okay everyone, we think it is all enough about our case report. Thank you for your attention and see you.